Now, nearly 500,000 new cases of Alzheimer's disease are diagnosed each year in the United States. This means that someone in the U.S. develops Alzheimer's every 67 seconds. Dr. Macie Smith, an author, aging expert, and Synergy home care gerontologist, joining me now to raise awareness about Alzheimer's in our community. Good morning.
Good morning. How are you this morning?
I'm doing well, thank you. So Alzheimer's is at the top of mind for a lot of people, as the baby boomers are getting older and we've got the sandwich generation taking care of our parents. What would you have to say about just, what do you want people to know about Alzheimer's? What do you think causes it? Tell me more about your ideas.
So I have lots of them, so I won't share all of them this morning, but Alzheimer's disease is not a normal part of aging. Many people think once you reach a certain age, you're going to get some level of Alzheimer's or dementia. That is not true. What we know now that we did not know then is that approximately 1/3 of the progressive types of dementia that we see, Alzheimer's being the most common type, could possibly be prevented with lifestyle changes, managing chronic illnesses, eating well, exercising, staying active, getting sleep. We do know that Alzheimer's disease is a progressive, untreatable, unpreventable 100% disease. And so if someone does develop it, then we have to be able to provide compassionate, empathetic care because their brain cells are deteriorating. And it's also important to know that dementia is an umbrella term. It is a group of symptoms or a set of behaviors that a person displays as a result of having a medical condition or some level of condition that's impairing their cognitive state. Mm-hmm. And so if someone is diagnosed with dementia, the very first thing you need to ask your doctor is what type of dementia it is or what's causing it.
But there are some types of forgetfulness that would be considered part of normal aging. What are the exact signs of Alzheimer's that you say, okay, but that's not normal? Okay, I mean, if somebody forgets where they put their keys, that's fine.
But aging memory loss, that is a true thing. I have my glasses on my face. I'm looking for them. I forgot they were on my face. That's normal. It's not going to progress into anything worse. When you start to notice that your memory is getting worse or you're forgetting more often than you normally do, or if you notice that in your loved one, maybe that forgetfulness and that memory loss, they're not able to perform reasonable tasks or routine tasks such as driving home from work, such as making a cup of coffee. And so when that memory loss begins to impair your daily life or your physical functioning or cognitive functioning, then that could be dementia. But again, you want to get to your primary care doctor, not the hospital, because the hospitalist doesn't know you. You want to go to your primary care doctor so that doctor can do a full blood workup to make sure it's not blood deficiency, to make sure it's not a urinary tract infection, also to make sure it's not depression, because depression could be treated.
Talking about, first of all, that's a good reason to have a primary care doctor and have a relationship with a primary care doctor. But also, a lot of times we see stories and we show video of Alzheimer's patients and, it's a sweet old lady, it's a sweet old man. But when you confront a family member about, hey, I think this could be the beginning signs of Alzheimer's, sometimes they get defensive. They don't want to go see somebody about it. How do we convince a loved one that they need to talk to their doctor and be honest about how much they're forgetting things?
So you're spot on. The last thing any of us want to lose is our mind. And so when you say Alzheimer's or you say dementia, that's scary to the person and also the family member, because you automatically think loss, forgetfulness, inability. And so you want to have a conversation with your loved one about a routine medical examination. That's something that everybody gets. You don't want to single them out to say they're different or there's an issue or you're going to be a burden, because that's when that, as you said, that defensiveness comes in. Also the resistance, not going to the doctor, not getting a reasonable diagnosis, not knowing what's going on. So that's very scary for families. So you want to have a routine, natural conversation about seeing the person's primary care doctor about their overall health. And I'll tell you, get involved with the person's doctor's office to become a part of their electronic health record. You want to be on that person's HIPAA form, so that way the doctor can share information with you. If the loved one doesn't want you on their HIPAA form, then you can help them create an electronic health record where they'll share the login information with you, and you can communicate your concerns with the doctor that way. And so the doctor will express a concern to the person, not you, so that may not fray the mother-daughter relationship.
Yeah. That's tough too, because they don't always want to give over that information. They think that they'll be fine until sometimes, it's too late, and we have to, take control of a loved one's things when they don't really have the power to make those conscious decisions anymore.
Right. And that's why you want to start early, before there's even an issue with getting those advanced care documents in place, those healthcare powers of attorney, durable powers of attorney. The best time to get those in place is when you don't need them. But you still can get them in place afterwards, but it can be a little bit more challenging. So you want to start having the conversation now.
What are some ways that you would recommend that we reduce our risk for Alzheimer's?
Maintain healthy lifestyle, eat healthier, low salt, low fat diet. You want to stay away from foods with preservatives, because when you build up inflammation in your body, you're building up inflammation in your brain. You want to stay active. You want to exercise daily. You want to learn new information. You have to be a lifelong learner. If you don't use your brain cells, you might lose your brain cells. So you want to be able to read new books, go to new countries, learn a new skill. When you're learning and you're thinking, you're firing off those neurons, you're building up a cognitive reserve, and that's when you're building a healthier brain.
All right, Dr. Macie Smith, that is all good information. Just quickly before I let you go, do you recommend the MIND diet?
So I don't subscribe to any one diet, but the MIND diet is one that I have participated in and would recommend to my clients. Also, the Mediterranean diet, which is also an anti-inflammatory diet.
Sure. Yeah. And the two are quite similar, too.
Yes, they are.
All right, Dr. Smith, thank you for your time this morning. That was all really, really good information. We appreciate having you on.
Thank you.